Welcome back to the Global Local, and thank you for taking the time out of your day to come hang out with me. For the guys that are new to my channel, welcome aboard. I really hope you guys get something out of today's video. And for the guys that's been with me for a while, as always, how are you, bro, man? Hope everything's good in your world. I hope your families are okay. I'm on the road again today, and I do got something I want to talk to you guys about, which is your healthcare needs for expats here in the Philippines. I got a question from a friend of mine this morning by the name of Will Cook. Hey, man, shout out to you, brother. He asked me, do you use TRICARE for your family healthcare needs here in the Philippines? And the quick answer to that is yes, but it's not just walking into a clinic and saying, hey, I have TRICARE, you can see me. It's a little bit more complicated than that, and I kind of want to cover that a little bit. I also want to talk about the VA benefits and, things that you need to prepare for should you decide to come out here and use these services, and other healthcare providers that you can use while you're out here, all right? When us guys come out here to the Philippines, a lot of us are not thinking about insurance policies or like how your appendix might feel after your new tropical lifestyle. But trust me, man, I do understand that. But how healthcare works out here as a foreigner is just as important as knowing not to drink the tap water out here. Let's just be real about it, all right? You need to make sense of TRICARE, VA, healthcare, your local options, and anything else that's related to your health while you're out here, man. You really need to make sense of it, because sometimes these things out here in the Philippines can be a little complicated, especially for expats, and it takes a long time to get things done. So preparing early will actually help you before you come out here. Now, I'm going to start with the TRICARE here in the Philippines, and it's not automatic, but it does work out here, all right? If you're a U.S. military retiree, a service member, or a dependent, TRICARE overseas, it will help you out here, all right? But only if you follow the rules, all right? Certified providers only. You can't just walk into a clinic and flash your military ID card and then magic's going to happen for you, all right? Because if you do that, you might just get stuck with the bill, man. I'm going to be real with you, man. It's kind of a hassle out here, in my opinion. And in my opinion, also, it only works around Manila area. Not when you go away from Manila, you kind of have a little bit more difficulty using that insurance out here. All right. What I would recommend that you do is research TRICARE Philippines provider, the Philippines TRICARE provider directory. Check that out to see if they can help you out. You might be hit with upfront payments. All right. Most clinics out here work on pay first. I don't care if you out here, you done lost your leg, man. You're going to pay first and then they'll see you, all right? And then they'll reimburse you later. Now, some of these hospitals do offer a direct billing agreement, but save those receipts too. They're your lottery ticket out here. You turn them in, hopefully you can get reimbursed back, man. As far as emergency care, go straight to the ER, but let TRICARE know as soon as possible, man, especially if the provider isn't in the network, all right? Emergencies are covered under specific guidelines. They're not just regular care. So, again, you need to check that out to make sure that you fall within the guidelines of how TRICARE works in your area. Now, if you got your kids out here, you got your wife, maybe your grandparents out here or whatever, I don't know, just family members, TRICARE benefits extends to eligible family members only, and the same rules apply, and I think the age is 21 to 23 or full-time students can use TRICARE. All right, they must go to certified providers as well, and a lot of times, again, like the sponsors, they got to pay up front, and then they got to file a claim for reimbursement. All right. So even if you have health insurance with TRICARE or anything else, it's good to always have some kind of emergency funds, because, again, you're going to pay up front. And then after that, then you try to get your money back, bro. Now, for the guys that are veterans that are getting married out here, and, you got new family members and stuff like that, if you want them covered under TRICARE, you got to remember, bro, just like you being active duty, man, you got to get them in DEERS. All right. And if she's in DEERS or your family members are in DEERS, then they'll be able to use your TRICARE benefits out here. If not, they don't care if you're married or not. She's not getting anything. All right. Now, moving on to VA. If you're a military member or you're a veteran that is out here, Army, Navy, Marines, Air Force, the VA hasn't forgotten you, man, but they just operate a lot differently than they do in the States. I think they only take care of primary care and preventative services. You can do some follow-up service-connected disability appointments and stuff like that, but you probably need to get a little bit more info before you just walk in there and say, hey, treat me for something else. They're not going to see you if it's not on documentation that's being service connected. All right. You also need to be enrolled in the FMP for care dealing with your service connected disabilities. All right. You can go to approved hospitals, and pay for the care and be reimbursed. You know, you got to go to you got to register with the FMP first before you start doing that stuff out here in the Philippines. All right. Now, as far as hospitals that are recognized in the Philippines for VA, you got St. Luke's Medical Center in Quezon City at BGC, and I think it's in Taguig. And then you have Asian Hospital and Medical Center. That's in Muntipula. I think I said that wrong, but yeah. And then you have Medical City Pasig, and then you have Makati Medical Center, and then Cardinal Santos Medical Center, San Juan. You might want to check those places out. The VA should have a list of places that you can actually see and get some information off their website to help you guys understand where do you get your VA medical coverage at outpatient care anyway. All right, again, a lot of places outside of Manila, they don't help you out that much, man. So you got to keep that in mind, dude. Me personally, I do recommend that you try something like PhilHealth out here. Is more localized and is more accepted widely here in the Philippines. You know, some guys come out here even on Social Security and they say, hey, can I use my Medicaid or my Medicare out here? And the short answer to that is no. They're not going to accept it. Medicaid doesn't work outside of the United States. You know, it's really not valid abroad. So you got to understand that when you're coming out here. A lot of guys coming out here on Social Security and they think I'm covered. And honestly, man, you're really not, man. All right. Like I said, PhilHealth might be a backup option for you. You know, and if you're eligible, it can really help you out. Don't expect it to cover everything. All right, but it's just a backup option. All right, think of PhilHealth as a seatbelt, not an airbag. All right, it helps reduce the cost, but it won't save you from the massive bill that private hospitals gonna hit you with. Now, to be eligible for PhilHealth, you need to be a foreigner with residency, or you have to be employed within the Philippines. All right, and the coverage does include inpatient care, selected outpatient services, and catastrophic coverage. Now, if you want to enroll in that, again, you got to go to the PhilHealth office and bring your ACR card or your employment contract, and you know, just bring all your documents, in my opinion, because here in the Philippines, what I've noticed is you go in and they tell you what to bring, and then they tell you that you forgot something that they didn't even tell you to bring in the first place. So just bring all your stuff, man, and you'll have everything with you. You ain't got to keep running around, and just make a whole bunch of copies of your IDs and all the other stuff that you think might be important, because here in the Philippines, I'm telling you, man, they'll give you the ringer with documents and stuff like that. Now, being out here in the Philippines, understanding how the healthcare system works out here, how the payment processes work out here, that's going to save you a lot of time if you do things in advance. Again, don't come out here thinking that, you know, all of the insurance that you have in the States work. Make sure it covers internationally should you bring something out here. And that goes for all Western countries. I don't care where you're from. Make sure your insurance is covered internationally before you decide to book that flight, or make sure that you have some kind of international coverage in pocket. All right. Now, that's all that I have for you guys on this episode. Please make sure you have all your ducks in a row, have all your documents ready for you to guys have some good medical insurance out here. I'm telling you, it's vital being out here in the Philippines. Make sure you love yourself at all times. I'm always tell you guys that. And also take care of your families, all right? Enjoy your stay while you are here in the Philippines. If you have any questions of me, hit me up in the comment section. I'll do my best to answer all your questions to the best of my ability, all right? Until next time, guys, holla at your boy. Peace out, bro.